Dental implants are a way that we can give support, stability, and function back after a patient has to lose a tooth for some reason. Okay. Dental implants are generally a titanium alloy screw, if you will, that goes into the jaw where the tooth used to be. Okay. The benefit right now, I mean, I know they're doing a lot of research with possibly being able to do implantation of teeth and grow teeth and things like that. But until that's all figured out, dental implants are seemingly the best way that we can replicate the natural look, feel, function, and aesthetics of our natural teeth. It's the best way that we have to be able to give somebody back all of those things once they've lost a tooth. Best candidates are somebody who has the initiative to ask about dental implants. Over the years, I've seen or heard patients come in and they said, oh, well, I just need this type of procedure or that type of procedure. Dr. Z or Dr. X told me that I wasn't a candidate for dental implants. At the end of the day, we have a lot of ways, advanced techniques where if a patient doesn't have the quality of bone or the height or the width bone in order to put a dental implant in locations, we have ways that we can help with that. And so I would never disqualify anybody from dental implants at this point with my training and my knowledge and learning. But I do think, number one, it's important to review medical history. There are things medical-wise that could disqualify somebody or that could mean that they may have a really tough challenge with that. Being able to review medical history for complications. And then just really, I think, current habits, right, that people have. We can actually make the oral environment a much healthier environment based on certain things if we have some time to prepare for an implant surgery, even if the patient isn't the best candidate one certain date and time. And so there are things that we can do if the patient's willing to do and make some modifications with things that we can improve the oral environment, which would enhance the implant process and the outcomes. One of the biggest pros or benefits of implants is that implants, once they're put into the jawbone, barring any trauma or any disease that happens, stabilize bone loss. Okay, so if we lose one tooth, okay, let's say I lose a middle tooth up here in the upper right area. If I don't do anything, the bone's going to shrink and it's going to ultimately impact the adjacent teeth to me. And the other thing is that adjacent teeth and opposing teeth will shift and move over periods of time, right? So it can change the whole bite. It can change the way that you have to bite and function. And I see this a lot. Patients come in and they say, oh, I just lost one of the back teeth. It's not that important. And then maybe they have to have something where they lose another tooth, right? So every tooth that we kind of take off the team makes for a bigger challenge sometimes, right? And our bodies are really good at compensating and learning how to eat differently and chew differently, but sometimes it puts additional stress and strain on other areas of the mouth, other teeth. And so the biggest benefit of an implant versus a bridge would be the stabilization of the bone loss and stopping that bone loss. A bridge is another good solution, and it is a fixed, what we call, inside the mouth. But sometimes, let's say that I've cracked this tooth somehow and the two adjacent teeth are perfectly healthy teeth. They've never had a restoration done on them. So if I was to do a bridge, I would have to cut the adjacent teeth, the healthy tooth structure down. And the research says, about 10 to 15% of the time, when you do something to a tooth, sometimes down the road, even that it could cause the nerve to misbehave. And then you would possibly need another treatment done for a root canal or a nerve treatment. So our goal is how can we go in for a patient, figure out what their goals are, what is the least invasive way that we can accomplish the end result for them, right? And it sounds like, oh, an implant, that's not least invasive. But if I've got two healthy teeth that I have to cut down and take away healthy tooth structure too, then we're talking about, well, an implant would be a less invasive for the total outcome of a patient. Dental implants last, and I would say it depends, right? I mean, I've got implants that have been placed early in my career that are still functioning well, and I've got implants that have been placed and aren't functioning well. And a lot of it depends on patient, maintenance is really important. And I always talk about, let's see, a house, maintenance on a house, right? If we get a new appliance, a new AC unit, or a new appliance, air HVAC or something like that. If we don't ever do any maintenance on those things, meaning we don't ever have any checkups done on them, how long will they last? Are they going to last as long as they could last from a longevity standpoint? I would say most of the time, probably not, unless you just get really lucky. Maintenance is really, really key for implants. Implants are fixed in the mouth. So one thing that's important is not only coming in and getting regular cleanings done to make sure that we're not getting any bacteria or complications like we can around our natural teeth or inflammation going, but implants are fixed in the mouth, okay, and they're stable, but they don't have any give. Our natural teeth have a little bit of give to them when we bite into things and when we chew our chewing patterns, because we have ligaments that stretch out. And so you got to understand that when you're looking at everything from a big picture, and it's really important that when you're making sure that everything fits properly, that you take into consideration the chewing patterns and the other forces that are placed on natural teeth, but as well as implants. And so that's one of those things as well. Implants can last a lifetime, I would say, given that you're committed to the maintenance aspect of it, barring any trauma, right, accident, or any major medical disease process that could cause complications with the bone or with the oral health. Here's what you can expect if you are interested in a dental implant to replace teeth or multiple teeth. Consultation visit, we're going to make sure that we get all the information. So we're going to get a 3D scan of the jaw, okay? We're also going to get some photography inside the mouth. In addition, we will usually do an intraoral scan. That's just a digital scan that does a digital replication of all the teeth and the gums and everything. And so those three things are kind of key components to the information that we need to gather for a consultation, as well as going over medical history, medicines that you may take, any other things that may be important from a medical standpoint to understanding any challenges or complications from any past things that have gone on. Once we do that, we'll gather that information, and we really do processes to do digital planning before we jump in and do the procedure. And what that does, it creates predictability. And I love, it's kind of like, now when we have our GPS and we say, all right, I'm going to go on this trip and this is my destination. So you type in the destination so you know where you're headed, and then it tells you how you get there, right? Well, you can take this route, or you can go this route, it's a little bit longer, or this route, you might have a roadblock or something. And so I love that because it really does create the predictability for the end result and the outcome. So we want to know, at the end of the day, nobody really cares that we can put an implant in or not. They want their tooth back. They want to smile and function better, right? And for the missing tooth space. So at the end of the day, what do we need to do? We need to understand the principles of where the tooth needs to go in the space, right? We got to put back the tooth in the right position, the right size, the right color, all those things. And that's some of those details are down the road once we have the implant in and we're ready to restore the final restoration. But if we don't plan that way ahead of time, sometimes we can get crisscrossed and maybe put the implant in the wrong place, or have challenges down the road. So we're really gathering all that information for the consultation. We're planning it digitally, and then when we start the process, it's much more predictable. It allows us sometimes to have a shorter treatment from start to finish for the tooth, the permanent restoration to be placed.